We are back on Morning Line. Our guest is Dr. Calvin Smith from over at Meharry. It's good to have him on. The guy's terrific about answering questions about COVID in a way even I can understand. It's really good to have you on, see you in person here in studio. Let's see, we've got a call from Shirley. Shirley, good morning. Hi, Shirley.
Hello, Nick.
Hi.
I just want to say this is my first time calling in, but I watch MorningLine all the time, and I follow you on Facebook.
Well, thank you very much.
You are a wonderful journalist. I just wanted to give you that kudos.
Oh, well, thank you very much. Are you healthy, taking care of yourself? Have you gotten a vaccine yet?
Yes, I actually got my third shot on the 21st. I have an autoimmune disease I've had since 1995, and I've been on steroids since 2003. Mm-hmm. So I definitely was in that category to get the third shot, because when I get a common cold, I have to get a Z-Pack. Yep. I can't even take medication over the counter. Mm-hmm. But I just had some advice for people that's taking the third shot. My second shot, I had a really tough time. I was down for 48 hours. But my cousin that's a RN told me when I took the third shot to take Tylenol afterwards. And I did that, and I did okay.
Oh, that's great. Well, thank you for your kind words, and I'm glad you're doing well and that you're in front of this and taking care of yourself. It's good to hear from you.
Yeah, and one more thing.
Yes.
Kudos to Dr. Smith. I'm a 20-year retiree of Meharry.
Wonderful.
I worked in marketing, communications, and PR. So whenever I see you, I get real excited.
You should. Well, Meharry's, thank you for that. Meharry's been a leader on this, you know, you and the other, Dr. Hildreth, I mean, do a great job.
Well, that, you know, my day is made. I'm smiling from cheek to cheek. So thank you for the compliments, both to Nick and myself. I agree with you about Nick as well.
That's nice.
But yeah, I mean, you know, again, another person who is immunocompromised, who, you know, is doing everything to protect themselves. And really, like, again, I want people that are listening that have some kind of hesitation to think about these people, that you don't know what kind of conditions people have.
Right.
You don't know what the next man, the next woman next to you has. And so you're doing these things out of the compassion and thought of these people. Right. And you know, it's amazing to me that she is willing to share her experience about what she went through with the second shot, what she went through with the third shot, the advice, you know, and she's not somebody that's really invested in it as much as a person like me, right? But is telling a true tale about what happened with her. And I think that goes a lot further than some of the other stories when people are reading from somebody that did some research on YouTube, or, you know, and I use research really lightly, doing, you know, not doing due diligence. So well, I'm glad to hear from Shirley, and I'm glad that she's doing well.
It has to be frustrating for you at times with some of the things you hear. And with me, and I'm no doctor, but I've learned a lot from you and others on Facebook, the comments and things that people send me messages, okay? I don't allow any of that crap to be posted on my page, okay? But some will send me this, and like people are questioning, oh, the FDA did a bait and switch on this FDA approval of the new Pfizer that's official now, and they're saying, oh, this, you better be careful, it's not really, you know, maybe you can just put that to rest. I mean, and a lot of people don't understand, there was an emergency approval from the FDA for these vaccines, but now finally they've received the full vaccine that any drug that goes through the process gets. Sure. And it is, the FDA didn't do any bait and switch, and there's not something hidden in there that maybe is tricking you into taking Pfizer now. Yeah. Just want to be clear on that. And maybe we're hoping the FDA approval that's official across the board encourages people that were holding out for that one, frankly, silly reason.
Well, so what I saw on my social media was a lot of goalpost moving. So people who said, okay, FDA approves it, I'm in. And then once the FDA approved it, they were like, well, you know, I don't trust this FDA approval. Right. Well, so I think you're dealing with some people who are just going to continually move the goalposts, and that's that group. But as far as like talking about the truth of the matter here, this technology to treat this vaccine, the mRNA technology that they use, has been in the works since SARS way back in the early part of this century.
Sure.
So this is like 13, 14 years in the making, and we just so happen to have another, because SARS and the Middle Eastern respiratory syncytial virus were all in the same family. They're all coronaviruses. And so they use the same exact technology, just with this particular virus, and it happened to be able to be effective against this version of the coronavirus. But this is not new science by any means.
No.
This is not something that has not been studied. And what we dealt with was the largest clinical trial ever.
Yep.
So this is more well studied than some of the blood pressure medications that people take, than some of the heart medications people take, than some of the medications they take for Crohn's disease and for MS, you name it. This is more well studied than Viagra.
Yep.
And I've had more patients coming, and Pfizer makes Viagra, so people trust Pfizer with their sexual activity, but don't trust Pfizer with their overall health. It boggles my mind.
It is. It's stunning, as you say that. The record is there of the treatment, and yet we have things on Facebook where people, or wherever they're picking it up, that are messaging me saying it magnetizes you. They're injecting you with a chip. And there are people who don't trust the science behind this vaccine, but because of some garbage they read online, they're injecting themselves with a horse parasitic that is supposed to help. And I know several folks, unfortunately, that have done so, and they're dead. So, I mean, where is the thinking here? They don't trust. They're trusting some joker online telling them about injecting themselves with a horse parasitic. You've heard about it. There have been stories about how people have been overdosing on this thing that has no bearing whatsoever, and yet someone read it somewhere, and they're trusting that over you or Dr. Schaffner or Dr. Hildreth, who are experts that have been through this. And they're just hurting themselves. These people have died. The biggest thing on this is you get frustrated, and neither you or I want to see anyone die.
No, not at all.
Okay, the problem with this is, you know what? Eventually I'm like, that's your choice, and if you croak, that's on you. The problem is these people are now turning their bodies into a P.3 dish that allows this virus to mutate, which then puts everyone else at risk as well.
Yeah, it's a bad situation, Nick, and I think about it from another perspective. Like, I have people who have pre-existing conditions, heart disease, diabetes, and things like that have had a very hard time getting the minimal amount of treatment that they need in terms of like an invasive treatment like a catheterization.
Yes.
Being able to be seen in a timely fashion when they're coming in with chest pain. Because the ERs are clogged up with people who chose to not prevent an illness that is preventable at this point. I have a very close friend of mine who had to fly from California to Memphis because her father had been essentially rejected from 2 other hospitals because they had no beds and no facilities to treat his chronic heart condition. Luckily, they were able to get to a 3rd place, but as I teach my medical students, time is tissue is the hardest concern. And so, we're having to put off these stroke patients, heart patients, for people, who have made a decision that generally, most of the time, especially once they're on a ventilator, regret.
I wonder at what point, and I know there's the Hippocratic Oath there or whatever, but if it were to get completely out of hand, at what point, and I mean, the medical community is frustrated by it, but I mean, at what point do you say, did you get a vaccine? No, you didn't trust it. Why are you trusting me now and coming to the hospital now? And it's not, see ya, but this guy's got congestive heart failure. We need to help this individual over someone who could have prevented this. You didn't, and now you're coming to us for help.
Well, we're already seeing with some insurance companies, they're treating it as if this is now preventable disease.
If I was an insurance company, I'm going to have a problem having to shell out the nose for someone who gets sick because they refuse to get the vaccine.
Now, for me, personally, because of the Hippocratic Oath and because seriously I take it, in my mind, I have thoughts, but my mind's thoughts don't transfer to the way that I practice my medicine. And so I would treat any and everybody. I'm not a told you so guy as it pertains to that because, I spend a lot of time in classrooms and I learn, and they didn't have that opportunity. And so, I'm not necessarily going to poo-poo them and I told you so. I'll treat people the exact same, regardless of how they came in. But, I would be lying to you, Nick, if I didn't say that it was not frustrating, that I'm not seeing a lot of frustration on my social media feeds from fellow physicians. The doctors, it was said that the doctors left. They actually just on their break went out and made a statement and went back in and practiced their medicine. So it's not like they abandoned the patients. But I think it was important for them to make that statement because we are people. I'm a physician, but I'm a human being first and foremost. If I were to walk out of here and get struck by a truck, I'd be, in a worse position than I was before I started at this. You know what I mean? So I say that to say that, at the end of the day, I'm just trying to do the same things that everybody else wants to do. I just happen to have a job that I studied for a long time, that I took out a lot of loans for, that I know quite a bit about. You know what I mean? And when it's my time to step up, like at the very beginning of this, people were praising doctors and nurses as heroes. And a lot of those same people now are vilifying them. And so, what I took from this is that, I don't go too high or too low. I don't take too much praise.
Way to do it.
I don't get too down either. I stay right where I need to stay so I can help the most people.
That's exactly, and that's what I would expect from you. Listen, we'll take a break on that note. We'll come back. Our final segment with more of your calls with Dr. Calvin Smith right after this. Stay with us.